Diyos marahinal daw po sa gabos. Greetings from the city of Naga. Naga City, known as the heart of Bicol, is renowned for its rich history, deep religious heritage, and a strong sense of community. With a population of over 209,000 as of the 2020 census of the Philippine Statistics Authority, it stands as the second most populous city in the Bicol region. However, like many growing cities in the Philippines, it grapples with significant social challenges, including the rising concern of adolescent pregnancy, which continue to impact the youth and local development efforts. Naga City's adolescent birth rate showed an escalating trend over the past 3 years. In 2020, the ABR stood at 21 per 1,000 births, but it increased to 106 in 2021 and remained high in 2022 at 110. This includes both Naga City residents and transients. The data shows a troubling trend of repeated pregnancies among adolescents, with numbers steadily rising over the past 3 years. In 2020, there were 39 cases, which increased to 56 in 2021 and reached a high of 62 in 2022. Addressing adolescent pregnancy needed bolder efforts as it was already compounded with limited access to reproductive health services, lack of adolescent-friendly facilities, and socio-cultural stigmas. The COVID-19 pandemic further strained healthcare systems, limiting outreach and education efforts while increasing vulnerabilities among adolescents. With that, Naga City partnered with the Challenge Initiative Philippines in 2021, a global platform co-managed by the Swillig Family Foundation and the Bill and Melinda Gates Institute for Population and Reproductive Health. Through this collaboration, the city established the City Leadership Team with the City Population and Nutrition Office as the TCI Lead Coordinator, which played a critical role in facilitating and implementing family planning and adolescent youth sexual and reproductive health initiatives. To directly respond to the challenges, we adopted high-impact interventions, which we implemented as partner of TCI. The decision to prioritize this critical issue stemmed from a careful analysis of key indicators. Data in Naga City's adolescent birth rate painted a clear picture of the challenge at hand. Furthermore, alarming rates of repeat pregnancy among adolescents highlighted the need for targeted interventions and sustained support. The barangay service point officers, who serve as key focal persons for family planning in the barangays, under the direct supervision of the City Population and Nutrition Office, meticulously conduct monthly profiling of all adolescent mothers and pregnant adolescents, maintaining an updated master list for better tracking and ensuring that young mothers and their children receive the necessary health support and interventions. We have also conducted trainings to other barangay health workers, making them more competent as adolescent youth health service providers. The City Population and Nutrition Office and the City Health Offices 1 and 2 have been accredited by the Department of Health as adolescent-friendly health facilities Level 1, demonstrating a commitment to providing quality care tailored to the specific needs of young people. Establishing teen centers in communities. From the Naga City Teen Center established in 2016, the city now has 10 teen centers in the different barangays. These spaces provide a comfortable and confidential environment for young people to learn about sexual and reproductive health, access services, and connect with trained health service providers and peer facilitators. Creating teen hubs in schools. By integrating adolescent and youth sexual and reproductive health information within the school environment, students can easily access crucial resources and support from their peers and educators. Currently, there are 5 teen hubs already operational in different public high schools, certifying barangay health stations as adolescent-friendly. The City Population and Nutrition Office and City Health Office are working to ensure that barangay health station offer a welcoming and non-judgmental environment for adolescents seeking health care, making them more likely to seek help when needed. Establishing the adolescent health and development through information and service delivery network. This network streamlines access to vital information and services, ensuring that adolescents can easily navigate the healthcare and social services system and find the support they need. Naga City institutionalized its AYSRH initiatives through City Ordinance Number 2023-025, otherwise known as Institutionalizing the Adolescent and Youth Sexual and Reproductive Health Program to prevent and respond to teenage pregnancy and appropriating funds therefore. Also known as the AYSRH Ordinance, the groundbreaking policy authored by one of the members of the CLT, Councilor Gail Abonal Gomez, aimed to curb teenage pregnancies and improve access to reproductive health services. The program places significant emphasis on strengthening social and behavior change communication, strategies to influence knowledge, attitudes, norms, beliefs, and behaviors to adopt healthier practices and social change. The Parent-Teen Talks, Hearts and Minds Seminars, Katropang Bagito, U for You, Usapang ASRH, Usapang Batang Ina, Batang Ama are regularly conducted in the communities. Since joining TCI, Naga City has built a self-reliant and sustainable model for adolescent health programs, significantly increasing investments in AYSRH and FV services. The city's funding grew from 2.2 million pesos in 2023 to 5.1 million in 2024, supporting teen hubs, training programs, contraceptive distribution, and capacity building for health service providers. Through these collaborative efforts, by 2023, the city's adolescent birth rate significantly declined to 71, and by 2024, the ABR dropped further to 20, surpassing the national target of 37. The total number of adolescent repeat pregnancies has remarkably decreased, dropping from 38 in 2023 to only 20 in 2024. The city's MCPR trend shows an overall positive result despite the slight decline after 2022. This suggests that family planning and adolescent health programs have been effective in maintaining high contraceptive use above the national target. So what have we learned so far? One, we cannot do it on our own. True, Naga City has been known as a center for good governance, but given the meager resources, establishing partnership with TCI has helped us significantly in providing capability building activities for our health workers, government officials, and service providers. Number two, the key to success is dependent on the participation of the youth sector. Given that AYSRH issues heavily impinge the youth, there is a need to engage them more fully in our programs and projects. Need for community engagement. The community itself will benefit from our initiatives. However, without their buy-in, our efforts would be for naught. Thus, as bridging leaders, we need to emphasize the concept of co-ownership. With all our efforts, success would not have been possible without the concerted efforts of our partners from national government agencies like the Department of Education, Department of Health, National Youth Commission, and Commission on Population and Development. We also extend our cordial thanks to the 27 barangay governments of Naga and the SK Federation. Last but not least, our heartfelt gratitude to the Challenge Initiative Program through the Swillig Family Foundation. As we look ahead, I urge each and everyone to carry the torch of advocacy for these high-impact approaches. Collaboration between and among educators, healthcare providers, policymakers, and community leaders is important in transforming our community from one that is responsive to one that is co-owned. With comprehensive sexual education, accessible healthcare services for the adolescent and the youth, community engagement, and a commitment to data-driven practices, we can dramatically reduce teen pregnancy rates and, in doing so, change lives for the better. Let us continue to work together for our youth, for their futures, and for a brighter tomorrow. Diyos mabalis.